It's amazing. Most people don't even realize that radiologists are doctors.
I think many people feel that perhaps we're insulated from patients and from individuals, and perhaps we practice our craft in a dark room.
A misperception of radiology and radiologists is that it is merely like reading a book. A radiologist integrates the pages and the words.
It's a science and an art combined. You study, you learn the techniques, you learn the equipment, you learn how to interpret certain things.
Most of my day is spent consulting with patients, referring physicians, discussing with patients their medical issues, and often performing examinations.
Everybody's always afraid of what we're going to find. But I can find a bad problem well before the patient's aware of it, well before it can hurt them.
I've dealt with several patients who've had ongoing chronic disease, and we'll see them for follow-up scans every 3, 6, sometimes every year. But you develop a relationship with the patient, and it's a good way to catch up and see how they're doing, and also be able to give them first-hand information of what's going on with their disease.
The patient comes to see us through a referring physician. We act as a consultant or a specialist, and it's a team approach. The radiologist, the patient, and the primary care physician.
It's very critical that radiologists read images. We are specifically trained in reading images. We spend years upon years training and learning how to read images. And
it takes a great deal of experience, a great deal of training to study the anatomy and identify the disease process and be the type of medical detective that I think the radiologist should be.
It's just like taking your car into the auto mechanic. You're going to take your car to a place that works on your type of car, that knows that kind of problem. And radiologists are the same thing. They are the best trained to deal with imaging protocols, understanding how to obtain the images, being able to interpret the images, and being able to relay that information to your doctor.
What a radiologist brings toward the care of the patient is integrating not just the images and the technology, but also looking at the entire file and also understanding all the types of nuances involved in what may be the cause of the patient's medical problem. Well, radiology is a broad term, and it involves things from just plain X-ray to interventional radiology.
In radiology, the basic X-ray is the mainstay of radiology, which has been probably one of the greatest contributions to medicine in our time.
Well, the X-ray procedure is a form of radiation, gamma rays, that pass through the body, and we can image anatomy on either film or today solid-state detectors to create an image of the body and search for disease.
A CAT scan is a three-dimensional X-ray which integrates the density of electrons in a three-dimensional space like the human body using a multiple X-ray source and integrated using computer software.
The other main contribution, I think, from a radiology standpoint is MRI, magnetic resonance imaging. That is an even better image of the body, and it uses radio waves and a magnet to create the image. As the patient is in the magnet, little radio waves, little bursts of energy are shot at the patient. They don't feel a thing, and it takes a look at every little atom in your body, and it spins in a certain way. When it stops to spin and the magnet's turned off, it then emits a signal, and then the computer analyzes the signal and creates a 3D image. Absolutely fabulous. It's as good as a drawing in an anatomy book.
PET scan is a positron emission tomography, and in PET scanning, it's a fairly new technology. It's in the past 10 years, it's really been very helpful in diagnosing tumors. How this works is there is a radioactive tag that's placed on glucose, which is a simple sugar in the body, and that sugar, as we all know, is used as energy for the brain, the heart, but also it's used by tumors. So when this sugar is tagged with a radio tracer, it lights up on our scans, and we're able to see where tumors are in the body.
And interventional radiology really is a misnomer, because it is a very non-invasive way to evaluate things which traditionally have been evaluated by more surgical or invasive methods.
Through interventional radiology, not only do we diagnose, but we also attempt to cure or participate in therapy.
So we can actually treat things ourselves and use image-guided therapies.
Small tumors can be destroyed, or clogged arteries can be opened. It's highly gratifying when the radiologist is able to participate in the care of the patient and effect a cure.
Well, I actually chose radiology not on purpose, but kind of through the back door. I actually was thinking of going into orthopedic surgery, and I had an uncle who was a radiologist in California, and he kept calling me and saying, "You've got to think about radiology. It is a fabulous field."
I was attracted to the technology, and I also found during the course of my training that the radiology department was somewhat of a crossroads, both for the patient, referring doctors, specialists. They all came to the radiologist in search of solutions to very complicated medical problems, and I saw the radiologist as somewhat of a medical detective.
You remember in like in a doctor's office, there are these things called Highlight magazine, where you circle the number of toaster ovens in Highlights magazine. I was always the one who could pick all the toaster ovens in those things. So for me, it was a great way to sort of build on my personal strengths as someone who had great visual skills.
I personally selected radiology during my clinical training in medical school. I saw that radiologists were a part of every patient's care throughout the hospital. And on every rotation, surgery, medicine, pediatrics, I noticed that the radiologist played an integral part in the care of that patient.
Well, the radiologist has extensive training. My personal training included medical school, internship, a residency in diagnostic radiology, followed by a fellowship in diagnostic ultrasound. I then spent 2 years in academic radiology practice, and then I went into the private practice of radiology.
I have enjoyed every minute as a radiologist. It's always something that I can participate with the patient. It is something that allows me to impact on their care in a day-to-day fashion and to make their lives better.
In terms of where I feel I've made a difference as a radiologist, I actually have a personal friend who was participating in softball. The softball struck him in the side and created a black and blue mark, a little bit of a hematoma. So we went back to his doctor, and his doctor decided to send him to our office to make sure there was no internal bleeding. We performed an ultrasound examination and a CT examination, and we discovered a small kidney tumor, which was removed. That was 7 years ago. He's doing very well, and it was very gratifying that we were able to find this early disease and participate in its cure.
I had an elderly patient come in for a mammogram, and she unfortunately had an abnormality on her exam. But when I sat down and talked to her, I said, "We're so fortunate we found this today, because we can take care of this, and you're going to be fine." And as a radiologist now, I can explain to the patient the process of what I found on her mammogram. I can actually do the biopsy, which I did for this patient. Unfortunately, proved it's cancer, but I've also found it early. And then we can get her set up to see the surgeon. And so she goes through this process without ever missing a beat. And it's taken care of in a timely fashion. She's back to health within, hopefully, months. If she needs additional therapy, she'll get that started by her radiation oncologist or the oncologist. But I always try and point it in a very positive light that, yes, we found an abnormality, but now we have a chance to do something about it. And this one particular patient I'm thinking of, 10 years later, she still brings me baklava every Easter.
There was one time when I was in training, a woman came into the reading room and came up to the clerk and said, "I want to speak to the radiologist who read my scan." I came in here for something completely unrelated, and the radiologist found a cancer in my colon. And because of that, it was diagnosed early, and I was able to get surgery without that cancer metastasizing. And I'm listening to this conversation, and I'm remembering, I think I read a scan like this. And the clerk says, well, this is the radiologist right over here. And I go up to greet her, and she just came up to me and gave me a big hug, and it was a good feeling.
I'm Dr. Kirsten Hansen, a board-certified radiologist.
I'm Dr. Lipset, and I'm a diagnostic radiologist.
I'm Dr. Raymond too, and I'm a radiologist.
I'm Dr. Michael D'Angelo, and I'm a radiologist.